Hey guys, so my name is Savannah, and today I just wanted to talk to you guys about a little Zoom conference that I attended a few days ago by the Columbia School of Medicine, specifically narrative medicine. So, I wanted to get into this. Basically, narrative medicine is pretty much defined as a different way of looking at patients and a different way of trying to go about the medical practice. So instead of just looking at a person from when they walk in the clinic doors to when they leave, narrative medicine is taking pretty much viewing them as a story, like as a holistic plot. They have characters in their life. They are people holistically. And so narrative medicine really involves taking a person for what their home life is, for example, how they take care of themselves, their mental health, even when you're just looking at maybe a heart condition. Like, you have to evaluate all these different factors and ask maybe, is there some trauma that this person is going through? Are there some indications that this person might be struggling with abuse or racism in the place that they're working? Like, you kind of have to read between the lines of every person that you're working with. And so there was a speaker who is an upcoming author with a book that is just coming out, who talked at the presentation. Her name is Danielle Spencer. And so basically, Danielle's book is called Metagnosis. She kind of walked us through the whole definition of that word that she created. Basically, when Danielle was a very young child, shortly after her birth, she had suffered a stroke and had a series of brain complications that followed afterwards. And she didn't find out about this until later in her life. I don't know exactly when, but she describes this as being a very pivotal moment for her. And it caused her to reevaluate a lot of things about her health and her life and the way that she was living it. And so, to basically start out by defining the term metagnosis, the word meta comes from the Greek prefix, also called meta. And it's basically kind of means above, transcending. And so when you look at maybe meta philosophy, that's the study of philosophy, which is its own set of sciences. Or if you metacognition is looking at how we think. It's not the thinking itself, it's how we do it. And also meta can be used to describe significant change, often physical change. When we use the term in biology, metamorphosis, the transition of a caterpillar from a little wormy creature into a butterfly, which is beautiful and majestic and not at all what you would expect the caterpillar to turn into in its life. It would likely remain the same, but no, it doesn't. And gnosis, which is the Greek noun for knowledge. And so when you combine these two Greek words, I forgot to mention, gnosis is also very heavily used in the medical community. For example, diagnosis, when there is finally an explanation for a person's set of symptoms, that person receives a diagnosis of a condition that can explain these symptoms. Another word is prognosis, which is a person's what their life is going to look like after receiving that diagnosis. Obviously, your life is going to change, so what can you expect? Maybe that's life expectancy, maybe that's ability, what you can do. And so Danielle Spencer really combined these two ideas of great change, great knowledge, to kind of make her own sense of what she was going through. And in this, she describes a bunch of examples, one of them being like not even medical, but genetic. For example, a lot of people are doing 23andMe right now, which is where you send in valve of spit, and then they'll take it, and they'll tell you all of your genetic history, who you're related to, and there are many people who are finding out that the people that they grew up knowing as their father their whole life are not actually their biological fathers. And so this causes in a person a great amount of stress, because and an identity crisis that will likely follow, because it's like, oh my gosh, if this person who I thought my whole life was my father isn't, then all these traits that I saw in him, in myself, I can't attribute to that anymore. And so and another example that Danielle gave was, she was talking about this book. Let me pull it up. It's by the author David Finch, and it's called The Journal of Best Practices. And it's basically about how his marriage to his wife of 5 years was failing. They were just not being able to communicate well with each other. There was this very tangible distance that was felt between them. And so his wife, on a whim one day, just decided to take this online quiz that would tell you oh, you might be on the autism spectrum. So as she took it, she was like, oh my gosh, this sounds like my husband. So when he got home from work, she made him take it. And as he was going through the questions, he was like, oh my gosh, I identify with this. This is really what I'm going through. And so when he got done taking the test and he got back the results that said you are very likely to be on the autism spectrum, he just had a breakdown, which was very abnormal for him. He was typically a very emotionally stable person, but he just broke down into tears because this new knowledge was so overwhelming. Firstly, because it was kind of relieving, because it meant that the issues that he was having in his marriage with communication and with that distance wasn't mostly his fault, and that it could be explained by his condition. But also, later, after he had received his actual clinical diagnosis of being on the spectrum, he experienced a kind of identity crisis, because he was like, well, how can I attribute the characteristics that I really like about myself? How do I know that my personality is actually me, separate from my autism spectrum? And so he kind of had to reevaluate who he thought he was in his past with who he is after receiving that knowledge. And so that kind of revelation, that process, is exactly what Danielle Spencer is trying to explain in her word metagnosis. She describes metagnosis as kind of being a process much like grieving, where the person has a state of initial shock of a lot of emotion, but not quite being able to process that emotion. And then moving into the stage where they start processing that, but that brings up a lot of questions about their identity now, because there was a person before that diagnosis, and now there's a person after, and where's the bridge between that? And so I think what Danielle Spencer's call to action is going to be in this book. Of course, I haven't read the book because it's not out yet, but I look forward to it. Is that, like, in the medical field, we have to start thinking about ways to kind of accommodate and to look for ways to help people through their diagnosis, through that new knowledge, because that is often very traumatizing for a person to learn that they have something that will completely change their life. And just, like, creating ways to manage that shock and, like, comfort people in knowing that they're the same person they thought they were, but also that this new information is something that they're going to have to incorporate into their life, as opposed to just, like, taking it all in at once or pushing it all the way. So yeah, I just think it's a very interesting idea that hasn't been talked about before, and I'm really excited to read the book. And yeah, alright, bye guys.